Hey everyone, it's Nancy, the nurse practitioner here for another video, and this one's on skin tears. Now, skin tears happen a lot, especially to older people with fragile skin, and you will know because you'll see black and blues on their hands or their shins. Mom or dad could be on a blood thinner or an aspirin product, and what happens is the skin just gets thinner and more fragile as you get older, and with a little bumping or banging, the skin can tear, and all of a sudden you have this skin tear that could be a real problem. So I'm going to teach you today how to take care of a skin tear, how to prevent signs of infections, and hey, better yet, how to prevent a skin tear. So first thing I'm going to do is tell you what supplies you're going to need if mom has a skin tear that looks like this. So this is actually, just so you know what a skin tear looks like, you're actually going to have the top layer of the skin either pulled away or totally removed by a tear, and this is the wound underneath. So good old saran wrap and magic marker did the trick for this wound today on grandma's arm. So this is what a skin tear looks like, and you're going to gather some things together. So I'm going to show you what you need. You need some kind of chuck, which you could cut up so you can use another piece, or just get yourself a nice towel that you can wash and use a new one every day. You're going to need some kind of non-stick dressing, which is sterile when you open this. You're going to need some kind of a gauze pad. A 4x4 is best, depending on the size of the wound, and I'll show you how that works in a minute. And then you're going to need a top dressing, a cling wrap to wrap around the wound dressing when you're done to hold it onto the skin, because you never want to put tape on someone's skin. It just makes more skin tears. You're going to need bacitracin for day 7 of the wound to heal. You're going to need some kind of paper tape. This is kind of thick. I'm going to rip it in half and show you how to do that, but you can use 2-inch, 1-inch, depending on how you feel comfortable. And you're going to get some kind of steri-strips. Now this I got from a rep or from somewhere along the way from a company, and they are little pieces of tape. Or you can buy this in the grocery store, Next Care, which is from 3M, and they look like this. Okay, you will need scissors to cut your steri-strips, scissors for a surprise idea at the end, a pair of gloves that will be good to wear after you wash your hands if this is your patient or you're taking care of a patient. If it's your mother-in-law and your family member, you don't have to wear gloves unless you feel like you need to. Just make sure your hands are clean, and we will do that. You will need some kind of simple saline or some kind of a spray saline, which is wonderful, and I'll show you how that works. You can get that at any grocery store or any kind of pharmacy. Or even one of these little bottles. They're just not hard. They're a little hard to control because it's a big mouth. Love this spray stuff. Cheap and well used, and you don't have to worry about spilling. Good stuff. And you also could get the Curl-X, which is a bigger, fluffier type, and cut it as you need it, which is softer, but I have some other ideas to make the area soft, so we'll go over that in the end. And I also found this really nice pack, which is all in one, in the grocery store from Curad, that has, if you look at it, it has Kling, it has the non-stick dressing, it has tape, it has all sorts of sizes of dressings, all one-stop shopping. So this stuff is cool. This is a good way to go if you don't know what to get after this lecture. Okay, so the first thing you're going to do is tell the person what you're going to do. You don't want them to be afraid. You want them to be involved and part of the whole dressing change. And you're going to first wash your hands. You're going to put a little bit of sanitizer in your hand, rub it together. Make sure you do the backs of your hands, your thumbs. Now, if you're near a sink with soap and water, by all means, take 20 seconds and really scrub it up. You know, wash those hands really well until the sanitizer dries. And, you know, just for education's sake, I'm going to put on a pair of gloves that came out of a box just to show you the aid if you're doing a dressing or you're a friend of the family and you're helping them out. You know, anyone can learn how to put on steri-strips and take care of skin tears. You don't have to be a nurse to do this. If you learn the right technique, you could be anybody doing this, okay? It's all about technique. So my gloves are clean, they're on. I have a garbage bag ready and taped. And in the end, I do have some tape, which is hard to cut when you have gloves on, but I've gotten really good over the years. You can actually do this, get your tape ready, put it on the side of the table, And I'm going to say, Mom, we're going to change this dressing and get it all better today, okay? So I'm going to get you all ready. We're going to put this underneath your arm. I'll try not to hurt you. Now, the important thing here is that this rolled up skin, if there's still skin there, you need to unroll it. It may take a little saline. Always turn your cap upside down when you take a saline cap off. Don't put it straight down. And just spray a little bit on the wound like this. Just a little. That's squirting me in the eye here. Let me see. Let me get this thing going in the bag. Just a little. Just a little. And you could either use a gauze, a spare gauze, which I will use this one to open up, just to kind of dab it and maybe help to unroll and clean the area of the skin that's bleeding. And if you can, with the gauze or with your gloves, while it's wet. Now, the important thing to do is don't wait 2 or 3 days to try to unravel the skin. It will never unravel. If you see a skin tear while the skin is moist, this is the time to do the wound care. All right? So gently, gently, and maybe you won't have it as easy as this because this is like saran wrap, but I have unraveled a lot of people's skin, and I'll show you a picture in a minute. It can be done. Just go slow and gently open the skin like this. And you may go like this with the gauze. This one's giving me a hard time. Now, sometimes the skin rips, and don't be worried about that. Do the best you can. I mean, it's not the best circumstance, but as you can see, I unraveled it here, and now it's nice and flat. Okay, and then this gauze is dirty now, so I'm going to throw it away. Now, what you really could do is take these gloves off, open up all your supplies, and put on new gloves. And I'm just going to do that for you, just for demonstration's sake. I don't have another pair of gloves here. But what I want to show you is now that you've gotten this wound already, you can now move Mom's arm away from the wet area because you don't want the new dressing to get wet. And you can open your supplies. The Telfa dressing or the non-stick is really cool. It just peels. There's a little peel. They all do that because they want you to keep the dressing as clean as you can. And it's really sterile in this package, so use the little thing as a table. The Kling wrap, you're going to open up the same way. It has a peel down. Peel it and open it and have it ready. The steri-strips open from the top. You won't need that many of them. Just pull out one package and you could set it down on your space. Just open this up. And if you need another gauze, since you have your box open, these don't open as well as the other ones, but they tear. It says tear. So just tear where it says that. What I like about this gauze is it's double thickness, so it's really fluffy. So you're going to get an extra protection on the skin. Put it on the inside of this and you got yourself a nice little table set right there. So we're all ready. We're going to take a pair of scissors. The little ones are easier, that are cleaned with alcohol, and we're going to cut our steri-strips. And what you're going to do is, the hair is a little bent here in the steri-strips, so it will help you know where to start. Otherwise you just fight with these things. Kind of like halfway down, depending on how big that wound is, and drop it on your paper like that. Okay. Now I'm going to put another pair of gloves on, just for education's sake. These are clean because I took off my dirty gloves. I opened up all my supplies. I got my tape ready. I cleaned the wound, and now I'm putting on my gloves. And these are clean gloves. And I've disposed of the old gloves in the garbage that's ready. If something hits the floor, leave it there till you're done, because the floor or anything below your waist is considered dirty. Just let it drop. Move Mom's arm away from the wet spot because you don't want the dressing to get wet. And then just take these little steri-strips. You'll need about 5 or 6 of them. Peel them away like tape. You may have to turn this upside down because they get stuck on everything. And you want to catch the wound skin. See the skin there? And just extend it away from the wound skin to the good skin to hold it down. And kind of window or just kind of move it around the wound like this. And here's 2 more. I'll just take 2 more off. Now you can see I got gloves on and they could fight you, so you just kind of get good at it after a while. But if you find it difficult, you may have to take off your gloves. But if your hands are clean, you can get away with that. And now we have a nice, ready wound care dressing here to help the skin to heal right where it is. We're going to then just pick up this nonstick dressing and place it right on the wound. You don't want to go back and forth. It's better to pick it up and place it down and hold it. And since everything's open, it's really simple. You pick it up, you drop it on. You've got your Kling ready. And if you need help, have someone hold mom's arm if she's moving around so it doesn't fall off. When you put Kling on, roll it away like you're rolling a roll of rolling paper, toilet paper. And don't go over the same place twice because you don't want to make like a tourniquet. Nice and gentle. Curl it around a few times till it feels nice and secure. And you can see I'm not going over the same place twice. Come back and cut so that the tape, when you put it on, is not where the wound is, because tape would not allow air to get in. You want to tape away from the wound. So let's just do one of these. Okay. You got enough Kling for another day. Put that back in the package. And you're just going to raise mom's arm, and you're going to put the tape that you cut right on that. Never tape to somebody's arm. Tape right to the Kling like that. Voila. Nice little dressing for mom. Now the important thing to know, and of course now you're going to get rid of your gloves. Throw them in your garbage. You can get rid of your papers. You can get rid of this. Whoops. And now you have this nice dressing. Now if the wound was really bleeding, you definitely don't want to put a gauze right on the wound because it sticks and then you rip those steri-strips off. You always want a non-stick dressing first, so look for non-stick. If it's really bleeding a lot, you could take something thicker or double up on your 4x4s and make them thicker. And this dressing is going to need to be changed every day. Now, some other things that you're going to want to get for mom is zinc. 50 milligrams helps wounds heal. Great for wounds to heal. 1 a day. If she can't swallow the pill, just crush it up in applesauce and she can take it like that. Vitamin C, 1,000 milligrams a day. Crush it up and put it with applesauce, or she can just break the pill in half and take it. It will help the wound to heal. Now, as far as the rest of the care to this area, and if she had just petechiae on her arms or legs, love socks. You can find all sorts of socks in all sorts of stores. Men may not like these socks, but they'll wear these, or maybe get, it's better if they're cotton white socks because they're easy to clean and they breathe well. But I love socks like these, and you can get them in the dollar store or whatever. And the reason why I'm suggesting that is because if people have black and blues on their arms and legs, you don't want them to get more skin tears. So you want to put something on to protect them. So you take a sock like this, and you cut off the toe, like that. This heel becomes the elbow, and the part that goes up near your knee becomes your handcuff. So we just slip this on to mom's hand like this, and it protects and covers this wound, and dressing keeps it nice and secure. And once the wound is healed, you could keep putting these on because you don't want another wound. Now, I have a picture to show you out of my book, which I'll also discuss with you in a minute. And this shows you the steri-strips and how we put on a wound. This is one of my patients and how I took care of her wounds. And then the Kling got put on top. This was actually a tube of Curlix. It just went on like a tube right over her. I just pulled it over, which was really neat. Pulled down her nice sleeve and then pulled down her bathrobe. And this is what the wound looked like on day 10. I mean, you can't get any better than that. And if you went to the emergency room, they'd try to stitch up thin skin, and it's really difficult. So steri-strips work wonderfully. And I've healed a lot of wounds this way. And if you want to see what a petechiae looks like, this is what happens on people's arms. Their skin and their hands are bony. They bang easily and bruise easily, and then these bleed and break open, and lots of trouble. So if you have something on a hand, let me show you what you can do with another sock. Let's use this one because I like blue polka dots. Do the same thing again. Cut off the toe. We gotta use the other arm, the one that we were using with the other wound on. But that's okay. We'll use, you know what, let me just take this one off and I'll show you. Oops. Hold on to that dressing. You could take this sock, and let's say mom has a petechiae right here on her hand, and you want to protect it. We'll make a hole for her thumb. You could first put this back on her hand. This is a nice sock. Look at this nice cuff. This is going to work really well. And where her thumb is, we're going to make a little hole. So you could just pull it up a little. I'm just doing this. You want to do it with her hand out of it. And that's kind of a big hole. But you see how that works? Covers her hand. If you don't do it right the first time, buy yourself another dollar sock. Don't worry about it. Just chuck them and use them over. And you could even sew these in a little. Look at how cute that is. That's really neat. Cute. I mean, we wear gloves now and mittens that are funky like that. So this is really neat. And that makes people want to wear them because they're not so ugly looking, you know? And it protects that petechiae from breaking open. And if there's anything on wounds on the legs as well, petechiae, do it on the legs. Put socks on all the way up to the knees. I will tell you, a lot of my people, they would know Nancy was there because they had socks on. Their arms and their legs, like, oh, Nancy must have been here. Hey, you can get polka dotted ones, striped ones, look like the Wizard of Oz, whatever you want to do, as long as you wear something on your arms to protect your skin. Now, you can unravel the dressing, and I'll show you how to take the dressing off if you'd like to see that. Get the whole effect. Take the sock off. Mom, we're going to change your dressing. You've washed your hands. Now you know how to put on a new dressing. I'm just going to show you how to take it off. You don't want to try to remove this tape. It'll never work. Lift up the Kling very gently. You might use better scissors. And just cut away the top layer like this. Now this is day 2. Every day you're going to be taking care of this dressing until it looks like it's healing. And the steri-strips start to curl up when they look like they're ready. About day 7 you could start taking them gently off. And if you have to put a couple more on to reinforce it for a few more days, take your time. Make sure the wound is healing. All right, I'm kind of making a mess here, but you get the idea. You could just unravel this. Have your bag ready. Take all this off, and as you can see, the steri-strips are still there. Look for signs of infection. Look for pus or redness or swelling. Mom, does it hurt? Does she have a low-grade temp? Is anything going on? Do you see streaking? And which is really important because a streak might mean that she's developing cellulitis or some other problems. So you can see it looks really nice, no problem. Look and see how much blood and stuff. Does it smell? Those are all signs of infection. Toss everything away. Wash your hands well. Gather your supplies and reverse the day 1. Okay? Mom might need a tetanus shot if she hasn't had one in 10 years. A tetanus shot is really important to consider getting. And now they put something called Tdap in it, which is a tetanus with acellular pertussis for whooping cough, just to protect her more. And it's called Tdap. It's good for 10 years. So you definitely want to consider that as well. So we talked about signs of infection, how to do the wound care, how to change the dressing, how to get funky socks to put on every day. And if you have any other questions, always follow me, Nancy, the nurse practitioner at Caregiver Success on YouTube. My book has all the information you need on all sorts of medical tips and tools you may find that you need for your mom or your dad or you as you're aging. From Nancy, the nurse practitioner, thanks for joining me till the next video on Caregiver Success.